about it anyway. Question number 3, this one's from Instagram too. What are the most common misconceptions about medical cannabis that you encounter, and how do you address them? One major misconception is that medical cannabis is simply a cover for recreational use. While my personal take is that most use of cannabis can be seen through a lens of having some therapeutic value, it's totally reasonable to think of medical cannabis as being used as intentional, controlled doses toward treating certain medical conditions with specific formulations, or to work towards a healthier you in the future. Another common myth is that it's highly addictive. While it's true that like any substance on earth, cannabis can be misused, the reproducible rates of addiction are consistently way lower compared to almost any prescription medication, on the order of 9 to 11%, same like coffee or exercise. Compared to opiates, benzodiazepines like Ativan, Valium, and Xanax, those are 3 to 5 times more addictive. So we're talking low addictive range overall. It's important to approach cannabis with an open mind and a scientific understanding, recognizing that like anything, it has potential benefits alongside potential risks when it's used without guidance or understanding. Thank you for joining me for this quick Q&A. I hope you found it helpful. I'm under the impression that education and understanding are key to improve the world of medical cannabis. If you have questions or thoughts, share them and stay tuned for next time. Thanks for watching.